So why do some patients with breast cancer, it metastasizes to the bone first, but others it metastasizes to the liver first, and others to the lung first? Why is that?
Hey everyone, welcome to today's episode of the Beljanski Cancer Talk Show. Today's episode, called The 7 Key Principles of Cancer Therapies, Emotions in Cancer, is super exciting. We're joined by Dr. Antonio Jimenez, founder and chief medical officers of the Hope for Cancer Treatment Centers, where he leads a team of over 200 employees, including over 25 MD physicians. For more than 30 years, Dr. Tony has dedicated his life to the study, clinical research, and implementation of integrative strategies to treat cancer, chronic infections, and immune disorders. He's widely respected by his compassionate approach and innovative treatments, which are grounded in his 7 key principles of cancer therapy. He is also one of the only 7 physicians worldwide certified to treat patients with the Gonzalez protocol. Please join me by welcoming Dr. Tony to the show. Dr. Tony, thank you so much for joining. I've heard a lot about you. Please tell the audience about who you are and how you got here.
Nice to be here and spreading the word of integrative oncology. And that's what I do for the last 24 years. We have a treatment center called Hope for Cancer. It started in Tijuana in the year 2000. And in 2015, we opened our Cancun treatment center, where we had the pleasure and honor of Sylvia being with us. And she actually gave a talk, a lecture to our doctors. It was beautiful. And so this is my life, my passion, my mission, because my dad was diagnosed with prostate cancer in his early 60s, and he didn't tell me initially. And then he started conventional therapy. That didn't go well for him. It was just 1 or 2 treatments, and he called me, said, "Son, I was just diagnosed with cancer. I did this and that, and I can't do that anymore." And I switched my career from surgery to trying to help my dad. And what a blessing, because my dad was eventually cured. He lived to be 83 and died of heart disease, nothing to do with the stage 3 prostate cancer that he was diagnosed. So I have many stories, but in essence, it is a mission. And Hope for Cancer Treatment Center is now serving patients from over 40 countries, all ages. And we're seeing a lot of younger patients now, more aggressive cancers, patients that were in remission coming out of remission. So now is the time to be educated, to be proactive. And everything you learn on these podcasts with the Beljanski Foundation, please take it to heart, be proactive, and start today, not mañana, not tomorrow.
But you make it sound like easy. There was your dad's phone call, and then you switched. But as a doctor, it was going to go taking you to a completely different path than what you had been trained for as a convention. So how different? What does it mean to become an integrative doctor? What are the difference between the therapies used by a conventional doctor and an integrative doctor? How did you have to retrain and open your mind and learn new things and apply that to your patients?
Yes, exactly. Because, for example, nutrition being one of the 7 key principles to my foundational therapies that I talk about in my book. But what did we learn about nutrition in medical school? Nothing. And so I found mentors. I was blessed to travel the world. Literally, I got invited by colleagues and friends from other countries. And it was many years, many journeys, many patients, and forming that network of older, wiser than me at the time, colleagues who had a lot of experience, and knowing that medicine, of course, is never static, right? So we're always learning. But it did take, as you say, Sylvia, that change in mindset. And for me, it was wanting to help my father, of course, and then wanting to help who is now my daughter. That's how I met my wife. Her daughter, at this age of 6 years old, was diagnosed with leukemia in Chicago, in the US. And the mom was told that with a bone marrow transplant, chemotherapy, her daughter had 50-50 chance of survival. And if she survived, 100% chance that she wouldn't be able to have children. And then her mom, Marcy, found me in Tijuana. I just had opened my clinic. I'm like, yeah, what can I do in integrative oncology? And so Whitney is now 29 years old and she has four children, beautiful, healthy girl, healthy children. And it did take that paradigm shift. But then I realized, even as an intern, when I was an intern, I saw that the patients had at least 10 medications. One medication to mitigate the symptoms of the first medication. And I was blessed how God has a plan for us, because in the hospital where I did my internship after the 4 years of medical school, they had a wing which was integrative medicine. And I saw that patients in that floor looked better, they were happier, and they were doing other things in combination with the conventional therapies, be it chemotherapy or radiation, but they were always doing other things. They were worried about attending to the immune system, attending to detoxification, and so forth. So I looked at this floor and then I looked at the floor of only conventional medicine, and these patients had no hair, they're vomiting, they're in bed, weak. And the other integrative floor, they oftentimes didn't even look like cancer patients. Yeah, there were many aspects in my career and this transformation, as you say, Sylvia, that really impacted me and for sure made allowed me to make that decision to go into integrative oncology.
Yeah, you were mentioning the difference of atmosphere between the way the patients are living through therapy when in conventional setting and in integrative setting. And when I visited your clinic in Cancun, had the pleasure to go to Hope for Cancer clinic in Cancun. And what really I was struck by, first, the beautiful setting, the ocean view everywhere, the serene atmosphere. And I was given a tour and I saw a room where there were several patients taking some infusion therapy. And generally, indeed, the atmosphere in this kind of rooms is pretty grim. It's a time where people reflect on their own mortality. And here, they were all smiling. They were all like taking a time for almost for meditation and felt good about their treatment, about their life. It felt, it did not feel like a vacation. It felt really good, really good. And that, I think that's a big part also of the healing journey, to feel good about your disease treatment and to make peace with the disease and the rest of the life.
And
Absolutely,
one,
Sylvia and Victor. We start every morning at both of our treatment centers in Tijuana and Cancun, Mexico, with we call it praise and worship prayer. It's open to all spiritual beliefs, denominations. We are Christian based, but it's open to all faiths. And start the morning with prayer and worship and meditation and focusing. Imagine how that sets the tone for the rest of the day, right? We oftentimes do dancing classes. And I remember an example. There was a couple, the lady had very advanced cancer. And in one of the activities, the patient started to dance. And afterwards, she was crying. And we're like, what happened? She said, this is the first time in my life that I have danced with my husband. Can you believe that? At a cancer center, right? And this was it just what it does for the mind and for the healing is unmeasurable.
Yeah.
yeah,
And I know that you pay a lot of importance to the connection between the mind and actually the healing process, whether it is for immune disease or cancer. Tell us more about that.
Yes, so much so that my next book coming out in January of 2025 is called Emotions in Cancer. So the link between traumas and conflict, these are sudden, unexpected, traumatic, shock experiences that we are not ready for, nor do we have a solution to at the time that they occur. And how does this down the line, a year, 18 months, 5, 10, 20 years later, contribute? And oftentimes are the main contributor to the onset of cancer. So, for example, a patient with breast cancer, is it the same to have breast cancer in the left breast versus the right breast? Or why is it? Why the left and not the right? Is it an accident? Is it what? But it has a very clear biological reason, because this is not psychology, this is biology. And so the left side is related to the mother child, the niche, the nest. The right side is more the male side. And so we know that every patient with left breast cancer, which by the way is the most common, is related to mother child, sexual abuse, bad relationship, ladies who have lost a child, maybe had an abortion, a miscarriage, or wanted to conceive a child but never were able to. So there's always a reason, a biological, emotional reason for the location of the cancer. And in the ancient times in Greece and Egypt, when someone went to a health facility, let's say Hope for Cancer, the first person they saw was not Dr. Tony, it was the spiritual advisor, the monk, the rabbi, the priest, the minister. And then they saw the emotional counselor, the mental emotional counselor. And then at the end, they saw the medical doctor. We were like at the end of the hallway by the bathroom, right? So they gave importance to the mind, above all to the spiritual health, then the mental, emotional, and then the physical. And now in conventional medicine, talking a bit of your first question about integrative medicine, that's another big difference. In integrative medicine, we focus on the holistic, right? The spiritual, emotional, as well as the physical, which of course conventional medicine does nothing about the emotional and spiritual. So, yes, the emotional aspect of healing is very important. And I tell patients who don't believe it or are hesitant about that is give it a chance. Give yourself the benefit of the doubt. And we have a program at Hope for Cancer called the BEST program, BEST, that stands for behavioral, emotional, and spiritual therapy. And I tell you that when they're out of those sessions with our practitioners who actually are medical doctors trained in this area of medicine and integrative oncology, when the patients come out of those sessions, they are transformed. That's the word they use. It's transformed because now they see the connection, they see some of the underlying causes that contributed to the formation of that cancer in that location. And guess what? Also to where the metastasis happen. So why do some patients with breast cancer, it metastasizes to the bone first, but others it metastasizes to the liver first, and others to the lung first? Why is that? Is that just random? No, we could go into the biological, emotional aspect. Is there fear? So fear is more the lung. Was there like where they had a near drowning experience? And so the lung will be the first target organ. Do they have conflicts with getting to one location to another, that they abandoned France and moved to the US, right? That could have been a trauma for them. So we looked at all this, and actually, I have a story, but it's a long story about a patient from France who, when I'll make the story short, she was in during World War II and in France, and the Nazis came into her house, and she was there with her father. And at that time, the father decided to leave willingly with the SS officers. And the little girl, at this time, 10 years old, she stayed behind. She never saw her father again. Eventually, she went to an orphanage and she made it to the US. She was about 10 years old at the time. Fast forward the story, when she was about 50, 60 years old, she developed right breast cancer. Remember, the male side. And what we found out is that since she was a little girl, she thought that the father didn't love her. He abandoned her because he didn't fight for her. she didn't see the father try to fight. But then we had her realize that he loved her so much that he sacrificed his own life to save her. And it gets a little more involved. We did a session which we call the fireside chat. And in that session, Sylvie and Victor, she started talking in French. And she hadn't spoken French since she left to the orphanage. And so it's amazing how when we go deep and we go to that area, and guess what? Miraculously or not, she was healed, cured from the
It,
cancer when she let go
yeah,
of the trauma.
it's a clearing. And there are now a lot of studies also showing that emotions start a cascade of very physical reactions, hormonal and so on, which then affect our body on a very physical and cellular level. So all that is actually biologically all linked. It's frivolous to believe it is not. And we are no longer at the time where Dr. Hammer was actually sent to jail for, he was one of the first one to say back, I think in the 40s, that there was a link between some specific type of emotions and some locations of cancer. He left a very comprehensive study linking a number of emotions, a kind of griefs, and location of cancer. And he started an entire movement. And the conventional therapist doctor jailed him because, oh my God, how can you bring emotion to the mix? That's going, cancer business is going to escape us. That was their approach. And in fact, it's completely ridiculous. And the success, and really, I would like you to speak a little bit about the success rate that you have in your home hope for cancer, because this is so much better than what conventional doctors are able to boast.
Yes, thank you for mentioning Dr. Hammer. I was blessed to spend some time with him in his home
Oh, really?
in uh, in Norway when he left Germany. Then he went to Spain, then to Norway, where he continued his work, and ultimately he passed away in Norway a few years ago. But I spent 3 hours with him in his home in Norway with Dr. Hammer. I also studied from a French fellow who continued Hammer's work, also Dr. John Claude Sabat. I don't My French is not that good, but Claude Sabat. And then another French guy in Montreal, Canada, Gilbert Renaud, also a French Canadian guy. So the best program that I mentioned stems from the work of Dr. Hammer and through total biology, recall healing, and then I myself made some tweaks. So it is a big part of our therapy. And to your question, I'm trying to pull up here the statistics because it's interesting that our attorneys have told us not to publish our statistics because this will go in the face of the cancer world, all the A's, FDA, AMA, and all that. But we did 5 year survival data for several types of cancer. And I'll mention that, for example, for metastatic lung cancer, we have to take into account that 70% of the patients that come to Hope for Cancer are stage 4, sometimes even stage 5, and they typically have failed conventional medicine. So it's not really comparing apples to apples because the NCI data, National Cancer Institute data, is not including stage 4 patients, right? For example, in stage 4 metastatic lung cancer, our 1 year survival is 77.8%, let's say 78%, and the NCI survival is 28%. So let's jump now to 5 years. Our data is 35%, 5 year survival with stage 4 metastatic lung cancer, and the NCI data is 5.5%. So we're talking 35% to 5.5. And then in pancreatic cancer, I want to mention that because this is a huge difference as well. 1 year survival with metastatic pancreatic cancer is 80% versus 19.4% for the NCI data. And look at this 5 year survival for pancreatic cancer. For Hope for Cancer is just under 32%, and NCI data is 3.5%.
Yeah.
Yeah, significant difference. And in addition, quality of life. because
Absolutely.
we have done quality of life studies as well, where we took into account several quality of life parameters like functional, social, cognitive, and others. And there was about an 84% improvement in quality of life from before the patient starts with us till 3 weeks, 3 months later. And then we also did longitudinal studies. A longitudinal study is where we look at the survival, and typically, gold standard longitudinal studies is 3 months, but we did a 1 year longitudinal study, and also the statistics were quite compelling. Actually, I asked my research and education team, headed by Dr. Chakravarti, who's one of those smart Indians that have more degrees than a thermometer, right? So I asked him, Dr. Chakravarti, you need to check this again because this is, I know we're good, but this was like, wow. So he checked it again, and his team checked it again, and he said, "Yeah, Dr. Tony, this was correct at the first time." So we constantly, Sylvia and Victor, we are doing analysis of how we could get better. What are results? We're always introducing new research and new therapies. So it's a labor of love, and we're blessed to have a research and education team as well.
Yeah. And the number of cancer keeps rising, but so is the number of immune disease patients. Are you able also to address people suffering from immune disease? And what is the relationship with cancer?
There was so much love at the conference. It was so easy to feel.
I met Sylvie last fall at the first annual Beljanski conference, which I love.
What I love about this conference so far is just the energy and the positivity.
Would you attend the next one?
The next conference?
Yes.
Oh, absolutely.
Would you recommend it?
Absolutely.
Great.
I brought 2 friends to this one.
I have had an incredible experience at this conference. As a breast cancer survivor myself, I found the information incredibly helpful, not just for healing, but also for preventing. Highly recommend.
It's amazing. I'm a healthcare coach, and the information that I've been able to receive here is going to change so many people's lives, to be able to have the resources, references, connections, support. I'm so grateful that I came.
And 2025 is going to be bigger, better, and even more impactful, and I hope to see you there.
Yeah, the interesting thing is that the foundational premise of treatment at Hope for Cancer is what I call the 7 key principles to cancer therapy that we were blessed to have published in 2012 at a peer reviewed journal out of the University of California at Los Angeles, UCLA. So these 7 key principles form the foundation of our cancer treatment. But you're right, Sylvie, it's the foundation to treat any pathology, because it does go back to, as Victor was talking before we started the podcast, is keep it simple. And this is exactly the 7 key principles applies to not only cancer patients, autoimmune disease patients, chronic disease patients, and guess what? Which I want the podcast viewers to really listen to is wellness and prevention, which is much easier than cure. Yes, treating autoimmune immune deficiencies are a part of what we do. I must say 90% of our patients are cancer patients, but we have other patients that come for us for non-cancer diseases and also for wellness.
Very good. So, speaking of prevention and wellness in general, what are your key recommendations when it comes to nutrition?
Yes, when it comes to nutrition, is first of all, nutrition is one of the most overwhelming aspects of health for a patient, because most of them, as we know, they're not following adequate nutritional guidelines. At our treatment centers, it's pretty easy because they're fed, they're given what they need to eat. But what happens when they go home? So this is a very stressful situation. Chapter 6 in my book, Hope for Cancer, is about nutrition. And I list, I believe it's on page 170.
Can you
Let me,
show us your book? Can you show us the cover of the book?
yes, this is the book.
Very good. So everybody
Hope,
sees the book.
yeah, seven principles to remove fear and empower your healing journey. And now my goal is to write a book on each of the 7 key principles. And as I said, the next one is emotions in cancer. And then after that, in end of 2025, it'll be nutrition in cancer, what we're talking about now. So here on page 170, I simply put, what are the food categories to avoid? And let me read them to you quickly. One is foods that are cancer triggers. Those are like margarine, French fries, potatoes. Those are foods that produce free radicals, generate free radicals, and so forth. So, cancer triggers. Second is cancer promoters. Those are like refined sugar and flour products, soft drinks, and most dairy products. And then the third category is immune distractors. What are those foods that are distracting our immune system? And these could be foods like animal fats, animal proteins sometimes, right? Because they distract our immune system. And then the fourth category are treatment antagonists. And some of you will not like this, but one of my treatment antagonist foods is coffee because it's a stimulant, and most patients, as we know, are in sympathetic dominant state, fight or flight. I know that recently, I think you interviewed Mary Beth Gonzalez from the Gonzalez Foundation, and or you will, and I'm a Gonzalez certified practitioner as well. And Dr. Gonzalez did a lot of work in sympathetic dominant cancers and parasympathetic dominant cancers, and 90% of all cancers are sympathetic dominant. That means that these patients are in fight or flight. Cortisol is high. So coffee is a stimulant, and we don't recommend that. And of course, alcohol, any fluoride or fluoridated foods and water. So those are the four main categories. And what can patients do to work on their immune systems on nutrition right away is keep it simple, avoid gluten, avoid dairy, avoid processed and refined sugars, and avoid GMO, artificially produced foods. Because see, it's there's a lot to be said about nutrition because there's the sugar-free cancer, the metabolic type diet. The reality is that cancer cells not only feed from sugars, they could feed from proteins or they could feed from fats. I wish it was that simple, that we stop all sugars and the cancer will die. No, then they start utilizing proteins. So you stop sugar, you stop proteins. Is the cancer going to say, oh, I'm going to die? No, it gets its food from fats. So you stop sugars, you stop proteins, and you stop fats, then the person succumbs because they're malnourished. So it's a balance, and the closer we are with nature, I guess that's another tip. The closer we are with nature and our food, I believe in my clinical experience of 30 plus years, the better outcome a patient would have. And not let food or nutrition stress them, because then that's a problem, the stress. And there's something also called non food nutritional factors. You could spend thousands of dollars eating at Whole Foods or getting all this organic food and all this. But what about if you're not moving? What about if you're not getting enough sunshine? What about if you're not blessing your food, praying over your food? All these things have positive mindset. If these don't go along with a healthy nutritional program, then even the best of foods are not going to have the maximum benefit for you. So we have to look at all these details.
Yeah, it feels people who are coming to your clinic are not receiving immediate treatment that they need to receive, but also a lifelong education and tips that they can bring home and will serve them well in the future as well as their family.
That's correct. That's correct. And oftentimes, when the patients come back for a 3 months follow up after their initial 3 week visit, or they come back in 6 months or a year, and they come back with their family member, whether it's the husband, the wife, the daughter, or the friend, they're like, oh, we feel a lot better too because we've been following what the patient did. So that's what we're here for, right? Sylvie and Victor and this Beljanski podcast is to educate, to inform, and to know that you can feel better. Sometimes we think we feel as good as we can, but not necessarily, right? Not necessarily.
Yeah.
We can feel much better. So we want to have health span and lifespan. We want to live longer, but good quality of life. And that's up to us. We can make that decision today.
And you will continue to educate us in Austin, Texas at the upcoming Beljanski Integrative Conference. Do you know already what's going to be the topic of your talk?
Let's keep it as a surprise for all those that are coming to the Beljanski conference in Austin, Texas in 2025. I highly encourage you to be there. It's a lot of education, not only myself, Sylvie, and her team, and prominent doctors that she's inviting and scientists, right? And the good thing about it is that we're not only backstage or in a room sequestered, we're within the crowd. Remember, of course, last year we're mingling with the crowd, we're talking, we're just sharing. It's such a beautiful event. Please share this information of the next Beljanski conference in Austin, Texas in 2025.
We don't know what's going to be the topic of your talk, but based on what you delivered last time, I think everybody will be in for a treat in next time.
We're in the trenches. We're seeing patients every day. So when we talk, it's not because of one person healing themselves, which I respect. We can learn a lot from that. But we're seeing patients every day, different ages, different cancers, different mindsets, all of it, right? So it's a lot of experience, and that's what I want to bring forth in my participation at your conference, Sylvie.
Yeah, it's pretty unique and so valuable. Thank you.
Yes, my pleasure and honor.
Yeah, Dr. Tony, please tell the audience how to find more about you, find more about your book, and everything like that.
All right. Yes, I think that the first thing is to get this book. It's not about selling this book, it's about education. Let me tell you a short story. We just have a patient, I think from Nebraska, and she has very advanced breast cancer, and she comes with a companion. No, sorry, from Canada. She comes with her companion, and in the consult, the companion says, Dr. Tony, I never came here, but I bought your book when I was diagnosed with breast cancer. And I followed your book, everything you said there, and now I'm free of breast cancer. And I didn't receive any conventional therapy. And now I'm accompanying my friend to your center. And I am so happy to meet you, to meet your team, and to see in person what you do. But all she did, not all she did, it's a lot, but what she did was she followed the guidelines here with the 7 key principles of cancer therapy. So I think this is like a little Bible of integrative oncology, right? And the website, Victor, is www.hope4, the number 4, cancer.com, hopeforcancer.com. And we have a team of doctors and admissions coordinators that will answer any questions. Just go to the website and you could avail yourself to our contact information, but that's the best way to reach us. But buy the book and come to the Beljanski conference next year. Oh, you know what? I just realized that I'll have my Emotions in Cancer book at the conference. So that will be, it will have just been launched a couple months before the conference. So that'll be exciting.
So I think I have a hint of what your conference is going to be about. It's going
Emotions and nutrition are the talks that people always love the most because not too many talk about that.
Absolutely. Absolutely. Very much looking forward to it. And thank you so much, Dr. Jimenez. Thank you so very
Thank
much.
you. Thank you for having me.
Yes, thank you. And thank you, everyone that got this far in the podcast. Thank you for listening. This is the Beljanski Cancer Talk Show, and we'll catch you next time. Thank you.